Hello everyone. My name is Suman Mishra from Zoho for Healthcare. And today we have Dr. Naveen Padmanabhan with us for a conversation on the future of oncology. Dr. Naveen Padmanabhan is the consultant and head of surgical oncology at Sringeri Shada Equitas Hospital, Chennai. Dr. Naveen has trained and worked at premier institutions including AIIMS New Delhi and has gained international exposure through clinical experience in Japan and the United States. He brings extensive expertise in the management of complex cancers. His area of specialization include head and neck cancers, thyroid cancer, breast cancer, and gynecological cancer. With over a decade of experience at leading cancer centers, Dr. Naveen is deeply committed to advancing cancer care through early detection, public awareness, and a patient-centered approach to treatment. Hello, Dr. Naveen.
Hello, Suman. How are you?
I'm good. How are you?
Thank you. Have a seat, please.
Thank you. So, I'm Suman from Zoho for Healthcare. So, I wanted to understand your journey. I wanted to understand what inspired you to become a doctor and specifically to specialize in cancer surgery.
I am the first doctor in my family. So the inspiration was from parents' motivation. So my parents had done some homework and they wanted me to be a doctor, and they motivated me. And naturally, after in my 12th standard, I had an inclination towards medicine, and then successfully I cracked and joined the medicine. And after joining medicine, surgery was my choice. But after choosing surgery, so we have to subspecialize, or we have to super specialize, what we call. When we rotate among all the departments, I found oncology to be more inspiring, and I had a natural liking and attraction towards oncology. So then I joined surgical oncology. So that was my journey.
Thank you so much, doctor, for the insight. So as we all know, today is World No Tobacco Day. So we all also know that tobacco is harmful for everyone. But I also want to understand, is there any experiences or any story or a patient story that has reshaped or influenced the early detection or cancer prevention? Can you share us some insights?
Yes. So as we all know, tobacco is very harmful, and we have a lot of patients who have had severe disease and undergone multiple treatments. But I would want to share particular two experiences. One was an auto driver. He was a tobacco chewer. He had tobacco chewing for past several years, and he has heard through some campaigns that a small ulcer can also be a cancer in all these patients, and he came at a very early stage. One of the earliest patients in 2023, when we opened this hospital, he was the first patient to get operated. It was a very small cancer. So we did a surgery for him. He didn't require any additional treatments like radiotherapy, and he's alive and healthy still now. He's doing really well. Another patient also, he was a tailor, and he also had used tobacco in the past, and he was always, and because of awareness, he stopped tobacco. But still, someone has said him that even though you stop tobacco, you have to keep checking your mouth or lungs, and he went to a dentist for a small ulcer, and then that was picked up as something, and he was referred to us. And when we saw him, it was a very, very tiny early cancer, even less than a centimeter, and he required only a minor surgery in the tongue. He didn't need for extensive neck dissections or any reconstruction or additional radiation therapy. So both of these, even though they were cancers, they were able to diagnose at a very early stage, and their addiction was not also very long, few number of years, but they were able to stop it, and they were able to diagnose at a very early stage, and they're having a very good quality of life after the surgery. So that these stories tell about the importance of health education, knowing why it's wrong, and if people who have smoked or used tobacco, what are the precautions, or what are the screening methods they used to take. Because of this awareness, they came at a very early stage, and they're successfully treated now.
So right now you spoke about the success stories, but I have my own circle I have my own relative who has gone through cancer and it went to a advanced level. I wanted to understand what is the biggest gap in the healthcare system that has suppressed it, or we are not able to detect it early. So what are your thoughts on this?
So, in our society, the major reason for delayed diagnosis are multifold. So, one is main reason I think is lack of awareness. Lack of awareness. Most of the people, many by and large, it's our 140 crore population. Many people don't know what are the early symptoms of cancer. Everybody knows that big, whatever they see in movies, a big ulcer or a big mass is a cancer, but they don't know early symptoms of cancer. So lack of awareness of symptoms, that is one thing. Second thing, they have a lot of symptoms, but sometimes they don't have access to healthcare. There are, even in this era in 2026, we have people who are coming from remote areas, they don't have access, or they are coming from a main area also, they don't have people to take them to care, like old age people who are children are living somewhere abroad or somewhere in other cities, so they have symptoms so that they are not bothering them. So that access to healthcare, that is also delayed. And next, social stigma. Even social stigma, they might know that a lump in a breast might be a cancer. They might know that, they have that knowledge, but they will not be open to talk to someone in the family or someone of their own doctors. So the social stigma around some cancers, or social stigma around some symptoms, they also delay the cancer. And next is denial. We see many of the tobacco users, they would have had small ulcers long before they come in an advanced stage. They would have thought that they would have gone to some doctor and they would have asked them to do a biopsy. So they would have ignored these symptoms, they would have denied these symptoms, and they come at a very advanced stage. That is also one of the reasons for late diagnosis. So screening programs. We don't have proper screening programs. In some countries, in Western countries, you have to have a screening mammogram, or you have to have a screening endoscopy in periodical intervals. But in many countries, even in India, we don't have a organized screening program. That is also difficult for the government to implement. Whatever screening we are having is through master health checks or individualistic screening, individuals going to screenings. So that is also one of the reasons of delayed diagnosis. So in our own, let me just tell you a story where we have a successful screening and a very poor screening. So one patient who had a very breast cancer, she had a very strong family history, multiple members. So she was in screening. She was coming to me every year, and one of the years, after 2 years, she got some spots in mammogram. We took that out. It was a very early cancer. All she required was a minor surgery and hormonal pills. That's it, and that's over. And she is now living her life. Another example, one of a young lady around 40, she had cancer. She had a very big cancer. She required surgery, chemotherapy, radiation, everything. Then she herself voluntarily told us that there was there was a screening mammogram which came to her place, and she wanted to, everyone was asked to do a mammogram. Probably 1 year before, this tumor would have been there and it could have been picked up in a mammogram. And I asked her, why didn't you go? I thought this something, why to go and why waste time. So that is lack of awareness. She didn't know that a mammogram can pick a lesion far behind. So that is lack of awareness. One success story, one late diagnosis story. So you can see why we are getting cases at a very late stage. What I want the audience to know, there are warning signs to any cancers, and all you need to do is to consult a doctor, follow their advice. So they might consult a doctor, but they might not follow through an advice. Just like saying that if a biopsy is required, it is required. If mammogram is required, a scan is required, it is required. So they might not complete the loop also. So they should know the warning symptoms. They should follow the doctor's advice. And many of these cancers, majority of these cancers can be picked up in early stage.
If I am aware, if today my family is aware, I can go to the place, I can go to any screening area and I can get a better outcome, is what I have understood.
Yes, correct. So basically, if you are aware about the symptoms, many of the tumors or many of the cancers can be detected at an early stage. And if we are detecting at an early stage, the treatments are simpler. The outcomes are far better.
Thank you so much, doctor, for the insights. Coming back to our discussion on World No Tobacco Day, I have an example. So there was a person there whom I knew. He had a cancer and still he could not quit smoking. Just curious to know, like, what has made an individual to drive, basically they are not able to quit smoking. What drives them? And why it is so difficult for them to quit smoking?
Yes. So if you see multiple studies, more than 70% of the individuals who smoke tobacco or use gutka, they know that this is harmful to them. Yes, it's label. It's even now, it's there in the label. Even before 5 years, where it was not made mandatory, many of them know it is harmful, but still it is, as you say, so addictive. So it starts in phases. First, they started in experimental phase. That is mainly due to peer pressure in college, in schools, or in jobs. Next, they go on to use occasional users or social users, like they use it in when they have some drink, or when they use it they have a party, and sometimes then it goes on to become daily use when they have tea 2 to 3 times per day. So from occasional user, social user is having in parties, then becomes a regular user, and then go for an addiction. So whole process takes few years. If you're progressing in a steady phase, and you will reach an addiction phase in 6 months to 1 year or 2 years, depends on the number of cigarettes or number of things you're using. Once you become addicted, why is it addictive? Why you're becoming addictive? Because it is linked to a substance called nicotine. Most of them know nicotine is a substance which is there in all these tobacco products. Nicotine activates certain pathways in the brain, and it gives us a dopamine surge, and it temporarily improves the mood, alertness also. So dopamine surge you have when there is a reward, when you have a sumptuous meal, or when you have an exercise and we have a high. All these things are dopamine surge. This dopamine surge is happening with nicotine. So this dopamine surge is one which drives the individual towards the tobacco products. And what happens? So slowly over a period of time, you develop tolerance. So what kick you used to get in one cigarette may last for half an hour or half a day sometimes. That becomes lesser and lesser as you keep using. So you develop tolerance to it. So once you're addicted to that kick, so you will want to do more number of sessions. So this keeps them entangled in this behavior. 3 levels of dependence. First is behavioral dependence. That is one day behavior, like I will smoke only when I have a party, when I drink. That is behavioral dependence. Then slowly it becomes I will take smoke when I'm having tea, coffee, or lunch, just for digestion or something. They invent new things, and that is behavioral dependence. And next is psychological dependence.
Okay.
That psychologically you might want it, so you say that you don't need it, but psychologically you keep craving. Psychological, that is in your mind. Okay. Then goes on physical dependence. So physical dependence is an extreme form where you are dependent on nicotine for multiple of your activities. So just like some people smoke and then only go for their toilet.
Yes.
That is one thing. Second, when they have heavy stress to work, they need to complete some projects or they need to be doing, they smoke because that gives them a dopamine surge, increases their alertness, and that is physical dependence. Tobacco addicts them in 3 aspects. First is behaviorally, then psychologically, and once they've crossed that, physically also they will make them dependent. Willpower alone is not enough to quit tobacco, because you have physical dependence, behavioral dependence, and also psychological dependence.
The next question is, there is a mindset of people that I can have 1 or 2 cigarettes in a day and that is healthy. I'm okay with it. So I just wanted to understand, is it okay to have 1 or 2 cigarettes in a day, or what is it? What is
So two misconceptions. They are saying that 1 or 2 cigarettes per day, nothing is going to happen. That is one thing. Second thing is I can stop whenever I want. So both these are misconceptions. First, let's deal with this. No amount of tobacco consumption is proved to be safe. No amount of tobacco consumption is proved to be safe. Any tobacco consumption, your health is going to get affected. There are short-term side effects and long-term effects also. So there are people who have smoked only for 2 years, come to us with tobacco cancer. There are also people who have smoked several years and come to us with cancer. So you should not take an example, somebody saying that XY person lives till 90 years, he smoked, nothing happened. That is the common stories. Yesterday I was talking to a person, and he was telling that those guys didn't smoke, they also have cancers. It's not only tobacco that causes cancer. That's a very flawed thought process. So no amount of tobacco is safe. It's not better to start it. And even if you're doing 1 to 2 cigarettes, that is also definitely going to affect your health. So the health affection, everyone knows, it affects the lung. You can have wheezing, you can have cough, you can get infections, chronic infections. There's something called obstructive pulmonary disease. It affects the heart. Heart attacks are frequent. There is heart failure. It can affect the heart, and it can also in long-term use cause cancer. And many of them think that several years multiple cigarettes only will cause cancer. Nothing like that. We have told patients who have smoked for 1 year or 2 and they've had cancers.
Oh, I never knew this.
Yes, that's a common misconception that smoking only several cigarettes for several years will cause. Yes, as the year increases, the risk also increases, but no amount is safe. And second thing, we talked about quitting. Many of them think that I can stop whenever I want. Tobacco dependence is a medical condition and requires medical advice and medical help. Okay, so if you know the statistics, out of 100 people, more than 75 knew that smoking or using tobacco products is harmful, and only 50 attempt to quit. Out of that 50, only 3 have long-term stopped it.
Oh.
So that is the statistics in one of the study. So tobacco dependence can have, even though they've stopped it, the substance is so addictive, they restart it after some time. They have relapses. So a person has stopped now and he has relapsed for tobacco after 6 months or after 1 year. Possible. That is all possible.
So whatever we discussed, I could feel that smoking is dangerous and it is very difficult for us to quit. Is there any ways, or is there any scientific ways that can be implemented or people can do to quit smoking?
Quitting tobacco is going to be a very difficult task for an individual. First thing is to identify that an individual. First thing is an identification by the individual that tobacco is hazardous. Most of the smokers think that this is not going to happen to me, or I have smoked less, so that is not going to happen to me, or someone has smoked more, he hasn't got it, why is it going to happen to me? So first thing is to understand that tobacco is hazardous. More than 50% of the tobacco users die a premature death. More than 50%. So next is to commit to quit. We have to commit to quit. The person has to commit to quit. So once they understand that it is hazardous and it is going to affect them and their family, then they will be willing to commit to quit. So persons who are occasional smokers, they smoke somewhere, they have to, quitting for them is going to be easy. Okay, so as I said, no amount is safe. Suppose you're doing once a week smoking or once a month smoking, that is also not going to have some health hazards to you. So no amount is safe. So occasional users should stop smokers. The dependence is going to be less. Next, regular users who have more physical dependence. as I said, cravings, stopping when they have strong cravings and all. Physical dependence is going to be more, so they require assistance. They require assistance in form of counseling, and they require assistance sometimes in form of medications, so where they can go for help. So there are multiple tobacco cessation clinics in every city. So if you Google it out, there will be in tobacco cessation in your nearby city or nearby town or wherever. And we have a national tobacco helpline whom they call. You can call between 8 to 8 am to 8 am to 8 pm. That is a free service offered by Government of India. Counselors will talk about tobacco cessation to you. They will give counseling to you. And everywhere, in every nearby medical college or every nearby hospital, there is a psychiatrist who will help you. Psychiatrist is the person. Psychiatrists and psychologists, counselors are the persons who will help you in doing tobacco cessation. So they will assess you. They will know what is your behavioral dependence, what is your physical dependence. They will devise strategies to help you come out of this tobacco. They might be you might be put on sometimes nicotine patches which will reduce your physical dependence. They will give you strategies, suppose behavioral, because if you're going to a particular place, let's say if you have a coffee break and if you go to that coffee shop and you're smoking, so one idea is to not to go to this place. A counselor or a professional can help you to know what are the behavioral patterns that is pushing you towards smoking, and they will advise strategies to prevent that. And once, let's say that you have come out of this smoking habit can have frequent relapses. Frequent relapses. You have stopped smoking. After 6 months, some life event happens. You go through a stress. You go through some life event. You start smoking again. This is a relapse. So you'll have to start from back again. And you have to understand that relapses, you don't need to shame yourself, or you don't need to be feeling very guilty that I have relapsed. Tobacco dependence is such a medical condition that multiple times people relapse going into the same habits. So once you relapse, you have to acknowledge that you have relapsed and you have to seek help again. So with multiple interventions, many people can stop smoking altogether.
Okay. So as you said about the premature death, according to Google, 6 lakh to 9 lakh people are actually dying because of the premature death due to the passive smoking or the secondhand smoke.
Yes, to give you some exact figures, so about 28% of our population smokes, which is roughly around 28 crores, more than that. This was a survey done in GATT survey done in 2016 or 17. That is one thing. Second is that we are the second largest consumer of tobacco in the world. First is China, second largest consumer of tobacco. And most of these tobacco consumption happens in productive age, that is 15 to 40. And once the effects of tobacco are going to be seen after 5 years or 7 years. So a person starts at 20, he gets some heart disease, lung issue or a cancer in his peak of productivity. That is around 30, 40. If you know that around 15 lakh cancers are diagnosed each year, averagely in India, and more than 40% of these cancers are directly and indirectly related to tobacco.
This is really a shocking statistics.
Yes. So many of the smokers don't deep dive into these figures. So our effort is to tell them again so that they are becoming aware and they seriously think about quitting.
So whatever we discussed right now, the numbers looks very huge. I wanted to understand how it is affecting a family. How a second-hand smoke or let's say passive smoking affects a family, a neighborhood. How does it affect overall an ecosystem?
So first thing, second-hand smoke is also known to cause lung diseases. When you are in a closed house and a person, let's say you're a male, you're smoking for a long time, short term it can have respiratory side effects to your surrounding people. They can get cough, they can get infections, they can get asthma, chronic irritation, they can get airway diseases, children and your wife or someone. Second thing, smoking long term, they smoke can also cause lung cancer. So smoking alone doesn't affect you. It affects your family members also who live close by to you. So second-hand smoke is also a known risk factor for several of these diseases like heart disease, lung diseases, and also cancers. So next thing is that many people will say, and I'm not smoking in the home. I used to go somewhere in the tea shop, I'll smoke there, or I go to the terrace, I smoke there. Second thing, they might say. So if you are affected, your family is also affected. That you need to understand. So suppose you are around 50 years or 40 years and in your peak of career, when your child is studying some in your school 10th or 12th, or when your child is about to get married, you have a major health setback that is going to affect them. Is it not right? So you need to understand that you or any person is a very vital part in the family, and if that person is pillar, so everyone is the pillar. Every female is a pillar, every male is a pillar. So one pillar is affected, the whole ecosystem is going to get affected. And you should also think, you are smoking, you have a son, he is going to think that smoking is normal. Father has smoked, why not me? You might not get it now. So when there is a life event, let's say you are around, your son is around 10 now, he might not smoke now, but when he comes to 20, getting into smoking is going to be very easy for him because you are already smoked and you don't have any locus standi to say that you cannot smoke.
Actually, the family has already normalized it.
Right.
Smoking is okay.
Yes. So various ways. Second-hand smoke, that can affect the family. Second thing, when you get affected, the family is getting affected, your productivity is lost, people need to come and care for you. Second, third thing, the next generation is also going to higher chances that they might also smoke.
With that, I have one more question that has framed in my mind. So let's say a person is there who is continuously smoking and they have smoked for a while. And right now what that individual will start thinking is, okay, smoking is, I have done a lot of smoking, I have affected myself. What is the benefits? I am not going to get any benefits if I am going to quit this smoking. So what do you have on that? I wanted to understand, what are your thoughts on these?
Yeah, basically you're trying to say that somebody has smoked for, let's say 5 years, 10 years, and already the damage is done. Should I stop now?
Yes.
So you need to understand that the longer the smoking, the longer the risk. So if you quit smoking, years by years, you have your health hazards and the health risk will come down. First, I'll talk about short-term risk. Within 2 to 3 days of completely stopping smoking, once your withdrawal symptoms, everything is your taste bud become better. Food tastes better. That is the first short-term thing. Next, your lungs get better. Okay. And your tolerance, the effort tolerance, the number of hours you can do an exercise, so the number of minutes you can do an exercise, so the lung gets better over next few weeks. And if you have stopped for more than 5 years, your heart disease risk, the extra risk, let's say the general population has 10% risk, smokers may, I'm just giving a ballpark figure, has 20% risk. After 5 years of stopping, that risk reduces to 50% less. Some 20% it comes down to 15%. And after 10 years of stopping smoking, it almost comes nearer to the normal population, the heart disease. And after if you're stopped, let's say 15 years or 20 years, your risk of cancers also start reducing. And it all depends upon the number of years you have smoked and the number of years you are remaining smoke free. So definitely there is a risk. Suppose you have somebody is at 40s, somebody is at 50s, stopping might definitely help them. Our life expectancy has increased. So the message is that any amount of cigarette you smoked, still quitting is going to be beneficial for you.
So with this, I also wanted to understand the theme for this No World Tobacco Day. So can you put a limelight to what it is?
Yes.
And
so this year's theme is unmasking the appeal. So tobacco companies have smart and they are becoming more smart. So they know that their customers are dying. So they need to find new customers. The smoking rates are reducing, but now they're targeting the youth. They're targeting the adolescents for newer tobacco products. They're marketing tobacco as cool. They're bringing new products like electronic cigarettes, and they're saying that is safe. Like as I said, that vaping is in electronic cigarettes or e-cigarettes are not safe. For a long time, they're using more flavored cigarettes. It is easier to initiate if there's flavored because the harshness is reduced. And they're saying it is a cool thing. They're using influencers to target the adolescents. They're using influencers. They're using marketing this as a social bonding thing. So once adolescents, they are starting at an early age, the chances of becoming addict is very, very high. So we need to unmask those appeals. All those things are lies. We need to understand all those things are lies, that e-cigarettes are not safe, this is not a cool thing, and recognize that this has a health hazard. This year's World Tobacco Day theme is unmasking the appeal.
So with this, it comes to an end of our discussion. So I wanted to understand, what message would you like to give to our younger generation?
My message is that if you have not been a tobacco user, well, congratulations, don't start and don't experiment, because chances of you becoming an addict is more. Second thing, tobacco chewing or tobacco smoking, tobacco in e-cigarettes or any form of tobacco use is hazardous. You need to understand that it is very hazardous to your health, and you need to stop these habits. Third thing, if you have been a smoker, or if you have been a tobacco user, all this you need to commit to quit. You need to understand that it has real health hazards and chances of you becoming sick is very high, and you need to commit to quit. And if you need to quit, you can. There are multiple services available at multiple hospitals around you, and also multiple phone counseling around you. So you have to make use of that. Third thing, next thing is that if you have been a user and if you have stopped and again you have relapsed, that is common. You need not be shameful about that. Reintervention in form of cessation advice, tobacco cessation counseling, and so tobacco cessation interventions can help you again quit. Thank you. That's the message.
Thank you so much, doctor. It was nice meeting you.
Thank you. Thank you very much for organizing.
Appreciate that.
Thank you.
Thank you.
Thank you.